we sat down with Pamela Merritt from Reproaction and Candace Bond-Theriault from the National LGBTQ Task Force to discuss how providers can improve their care. How can providers understand their power and show respect for patient concerns?
You know, we're taught from a very young age to not learn about our own bodies, but to listen to someone else tell us about our bodies, and putting all of our faith and our understanding from somebody else, right? Which is problem number one of not having, comprehensive sex education, but also putting power into an institution or into somebody else's decision making is problematic, but also that's where we are, and that's the status quo, and providers need to recognize that. They need to recognize that when someone walks into their door, you are the closest thing to God on earth, really, right? You're helping them decide how their life is going to go. What's the next step for their health and wellness? And how can you as a provider do the unlearning of your biases and your stigma, but also how can you recognize that and recognize the importance of the work that you're doing? I can't even tell you how many times, I've been to a provider and I'm like, this is really serious. And they're like, whatever, you're fine. Sometimes the experiences I have, providers aren't taking things as seriously as patients are taking them. This is their health, this is their life, this is their everyday. And just because you've seen something over and over again and it hadn't been a problem doesn't mean you shouldn't take the care to treat this person as a respected, dignified human who is concerned about their health and well-being, of whether it's themselves or their families.
How can providers work to improve care and lift up diverse patient populations?
When you're not listening to what they need, that's problematic in and of itself. I think also getting family history and understanding that some cultures struggle to give family history. I didn't find out that I had several aunts who had fibroids and endometriosis until I told them I had fibroids and endometriosis in there, because my family's weirdly conservative about that stuff and they just don't share that information. So respecting that people come from different cultures and might encounter healthcare a different way. And then I also think having a dialogue and a conversation is very important, because what people are scared of is often what they have a family history and have good reason to be scared of. And I think, for every emotional wall that goes up, it is sourced in something very real, and that needs to be respected. And there are communities and cultures who have every right not to trust healthcare providers because of the history of abuse, of experimentation, and of eugenics sterilization in this country. And simply through getting out and doing volunteer work and or participating in community events, you can learn so much about your fellow human. Nothing can replace the human interaction. I will say that Planned Parenthood and community health providers are a tremendous opportunity for people who are going into any kind of medical career, because they allow for you to actually see a ton of people from various backgrounds in various conditions and states. And so, because Planned Parenthood is a trusted provider in community healthcare providers, you might see people who are transgender. You might see people who have their child translating because they're a refugee. And you're going to encounter those situations far more in a way that isn't necessarily like an emergency room crisis, where that's a different interaction. So I think that might be a way to encounter, but there's nothing you're going to learn about how different culture manifests itself unless you get out into the community. And I think there needs to be more opportunities to do that. And the doctors, the OBGYNs that I know who have provided at the community level through Planned Parenthood or through a community healthcare provider, get it. they are wonderful, and they absolutely will say that they learned that through their patients. And when they talk about certain issues, they take away the I statement, and they're like, my patients say. And that's when you know you've actually been listening and you're taking that in.
That's a part of the work, is realizing the role, but also if people are really interested in getting to this liberation and liberatory moment and movement, it's about recognizing when to give up that power. And so it's about being in a position of power, but also using that privilege and being willing to give up the power if it's for the greater good.
We then ask them, how does wellness connect to care provision?
So, and I think providers need to take care of themselves too, right? I think that is harmful. Like, it's harmful to go to a provider who's been working an 80-hour work week. That's not helpful to me. Like, I don't want that. Like, I want you to sleep. I want you to, like, eat well. Like, I want you to live well. So I think that's a big thing that needs to change too in the medical profession, is just the absence of self-care that providers have for themselves is like really harmful for everyone, including themselves and their patients.